So last time, yes, sir. Last time we talked about the calculation, how to do the ovarian cycle. Do you still remember?
Yes, sir. Yes, sir.
Good. So if I randomly pick a particular age, I hope you can do the calculation for me. Can you?
Yes, sir.
So let's say that. Let's pick the paper. Let's go on quickly. This lady had her menarche at 17 years. She's currently 45. 17 years, she's currently 45. How many oocytes has she released? Quickly. Quick. If you have the answer, you just raise your hand quickly. How many oocytes has she released? Yes.
She said 3 reasons.
Okay. Prudent.
3 reasons.
Okay. Prudent. Are you the one talking?
No, this is Beatrice.
Okay, Beatrice. Prudent, your hand is up. Yes.
444.
Hey. Prudence. I had 400. Okay. Oh. 336. Beatrice, can you explain to us? That's the correct answer. How did you get it? Can you explain so that Prudence will know why?
I subtracted 17 from the 45.
Mm-hmm.
And the answer I had, I multiplied it by 12.
Okay. So that is it. So that's the oocyte she has released so far. Okay. Good. Prudence. I hope you heard it.
Yes, please.
Okay.
It was typo error. It's not 45.
Hey, Prudence. Oh, that's nice. Okay, so now that we are done with that part, today we're going to looking at the cycle, the ovaries, what they secrete. Oh, we've done that. I thought we ended the calculation, or we went further. So we reach endometriosis. So we look at, so we even talked about how menses occur, isn't it? No, then that's good. So we're almost done. Let me get the PowerPoint and then start with it. Okay, so let me share my PowerPoint with you. So, how do menses occur? Can you explain that to me? How would a lady get a menses? Quickly, for 10 marks. Yes, who will do that? Get the right on spot. Yes, let's see what you're going to get. Who will try? No hands up. Okay, Catherine.
Yes, sir.
Good afternoon, my dear.
Yeah, so this is that for the menstruation, if there's no implantation, the progesterone goes low,
Good.
making the blood vessels to constrict.
Good.
Then it will prevent oxygen from going to the functional layer.
Okay.
So when the vessels constrict, the place will become ischemic.
Okay.
There is no blood flow to the place. Then the layer will die off. Then there will be sagging of the blood vessels will come out as a menstruation.
Okay. That's nice. 9 over 10. You left something out. Something small. You see, when progesterone goes low, it is the muscle, the myometrium constrict, forcing the blood vessel to also constrict. And the blood vessels in the functional layer are very tiny, so they constrict totally. Okay, so that is it. Thank you. So it means that if somebody is pregnant and progesterone goes low, the same scenario will happen. If somebody is pregnant and progesterone goes low, the same scenario will happen. So progesterone is one of the best hormones we have. It is the hormone that keeps pregnancy. If you want to be pregnant, check your progesterone level. And when would you check it? At what level would you check your progesterone? Have you done that one? Have you looked at the hormones?
No, sir.
Okay, fine. So let's start with that. Let's start with the hormones. At least this group, I hope you keep like you stay like this in exams. Yes, I'm going to do exams. I'm not to papa. Okay. And then where are the rest? You are just 560. Where are the rest? Cosrep. Yeah, you. Whatever we are going to do today is very important. Okay. Have you seen the slide? I've shared it.
Yes, sir. Yes, sir.
Okay, so what we call menstrual cycle is actually 2 in 1. Menstrual cycle is uterine cycle plus ovarian cycle. Okay, menstrual cycle is uterine cycle plus ovarian cycle. Most people describe menstrual cycle using only one. They can talk about uterine cycle and they refer to it as menstrual cycle. Others also talk about ovarian cycle and they refer to it as menstrual cycle. Menstrual cycle is the embodiment of the two parts, uterine and ovarian cycle. If these two cycle match 1 in 1, you see, it means that if these two cycle, when, for instance, if the follicles are growing and then they're shedding off of the functional layer, and then whilst the functional layer is growing, the follicles are also in the latter stage, that's the Gravian stage. You see, and when ovulation happens, the endometrium is ready. When you have a lady that's uterine cycle and ovarian cycle are in line, we call the lady as a synchronized lady. Synchronized side that usually the cycles are in line. For others, it doesn't happen. For others, whilst they are in their menses, they are ovulating, and those we call them desynchronized women. Okay, so we have 2 types of women: synchronized and desynchronized. Each of these ladies can usually give birth depending on the person taking care of them. Okay, some people don't even know we have desynchronized people. Okay, so for you, who are you? You see, so when I meet you, the first day I will meet you and I ask you, who are you? I don't mean your age. I mean, are you synchronized or desynchronized? You should know this. Okay, so are you all synchronized or do you have some desynchronized here?
We are synchronized.
My dear, say I am. Some people are seriously desynchronized. Now I'm going to use 28 days cycle, okay, as a case study. You see, when you have 28 days, it means that 28 days people are many. In life, when you have a lot of things, when majority have a particular aspect, we say they are normal. When it differ, we say it's a bit, it varies. We don't say abnormal. Abnormal means it's a particular problem. Okay, it varies. So since most women are 28, I'm going to use 28 days as a landmark for this particular study. When we are done, if you are 30, you just add +2. If you are 26, you just subtract -2. Okay, just subtract whatever is in there. Okay, so let's look at this and then do that. Now, can you draw a number line for me? Draw a number line and then have 1 to 28 on it. But don't do 1 to 28. Make it 5, 5. 1, 5, 10 in that order, so that when whatever we say, you can easily know where to put it. Okay, so quickly draw a number line. If you look on the page, there's a number line drawn there, but don't count 1, 2, 3 up to 20. That's too outrageous. So make it 1, 5, 10, 15, 25, 26, 27, 28. Okay, are you done? Are we all done? Are we done? Okay, so let's do it this way. When you say first day of menses, that's day 1. Okay, day 1 is the first day of menses. The first time you saw blood, or the day that you saw blood, that's the first day of menses. Okay, please, menstrual cycle does not run from blood to blood. Okay, the first day you saw your menses is day 1, day 2, day 3, up to the last day. And then it's not the first day you saw another menses. The first day you saw another menses is also day 1 for another one. Okay, so the first day you saw the menses and the last day before the first menses of another cycle, that is your cycle. So please note that. Okay, so let's do uterine cycle first. So on the number line, from 1 to 5, write menses. 1 to 5, write menses. 1 to 5, write menses. Are we there?
Yes, sir.
Good. Then we are doing uterine alone. Okay, so from 5 to 10, write safe period. From 5 to 10, write safe period. Are we there? Good. So safe period. Okay, so the day 10 is a bit risky. Day 10 is a bit risky because we have some food that you eat, you ovulate quickly, and then stress can also do that. Okay, so ovulation can be in a fixed mode or can be in an early stage or late stage, depending on the situation. Okay, so day 10 is risky because the sperm cells, we know they can live in the corner of the oviduct for 3 days. Okay, when they pass through the uterus, the area that they go and hide, the first part of the oviduct is called the corner. They can be there for 3 days. So if you have sex on day 10 and you ovulate 3 days after that, you can get pregnant. Okay, so that's why we say day 10 is a bit risky. Okay, now for uterine cycle, day 11 to day 17, write conception period. 11 to 17, conception period. This is the time that we get pregnant. This is the time that we get pregnant. Actually, some books have made it 5, but I'll make it 7, so that when menses delay or is early to be captured. So for a lady that the tubes are potent, the husband has no problem. From day 11 to 17, whatever it is, she'll get pregnant. Okay? I'll teach you some more things today. I'll go off the syllabus. I'll teach you these things so that you use it for your practice. So 11 to 17, conception period. So this is the time we tell a couple to have sex. But this sex aspect should not be every day. Remember, we said the tail of the epididymis contains the mature sperm cells. When they are empty, it takes 48 hours to replace them. So usually we tell men to have sex every other day. So 2 days, 2 days. So day 11, day 13, day 15, day 17. Maximum 4 times within that period. Are you there?
Yes, sir.
Okay. So if you look at your timetable very well, you have 1 to 5 as menses, 5 to 10 as safe period. Okay? And then you have 11 to 17 as conception period. Then 18 to the next period is also safe. So you see, there's more life after death. There's more life. So those of you who don't want to get pregnant, you know what to do. The first safe period is short. The second one is very long, 18 to the next one. Almost like 10 days. Okay, you can put your head down, leg up, whatever. Nothing will happen. Okay, you should know what you are doing. So don't take these family planning pills much. They are all progesterones. Don't take them much. Okay, you can take them when you have sex from 11 to 17. Those ones, they are risky. But apart from that, nothing will happen. Now let's add the ovarian cycle on top of this. With the ovarian cycle, from 1 to 13 is known as follicular stage. Follicular stage. So if you look on the screen, that's the time that the primordia is going primary 1, primary 2, that's the unilaminar, the multilaminar, and then we go to secondary 1, secondary 2, where the antrum is becoming big. Okay, so that is follicular phase. from 1 to 13, follicular phase. And then the same thing for the uterine cycle. I'm comparing it. You see, uterine cycle, we have 1 to 5 as menses, if you remember. So 6 to 13 for uterine cycle is also known as 6 to 14 for uterine cycle is known as growth stage. Growth stage. What's the growth stage? How do you pronounce it? Growth stage. P-R-O. Does it click something? Growth stage. P-R-O-F. Hey. Proliferative stage. Okay. So remember that the follicular phase is equal to menses and proliferative phase. Okay. Because menses do happen to uterine cycle. Okay. So at times, be careful how you use the stages. Follicular phase, be careful how you use it, because follicular phase is never equal to the uterus. Follicular phase is equal to menses and proliferative stages. Okay. Now, for the uterine cycle, at day 14 is known as ovulation. Day 14 is known as ovulation. Day 14 is known as ovulation. And the hormone responsible for ovulation is LH. Remember, we said that when the secondary oocyte, the secondary follicle or the Ovarian follicle, when it gets space and absorb things, under the influence of LH, there's turgidity, so that the follicle will blast, releasing the oocyte. It will do that under the influence of LH. When LH surge or goes very high, the Ovarian follicle cannot contain the oocyte anymore. It will burst open, and then the oocyte will be liberated. That is ovulation under the influence of LH. So if you want to check somebody's LH, you check it half of the cycle, which is 14 for 28, 15 for 30, 13 for 26, and the others. Okay? So notice somewhere, LH is checked half of the cycle. Half of the cycle. So you need to know your client's cycle. If you want to check the LH, LH is the hormone that determines that you ovulate. If you check it half of the cycle, there will be a range. There will be a follicular phase, there will be ovulation, and then the luteal phase. So there will be 3 stages as ranges. Check, because you did the one at the ovarian, the ovulation stage, the values will be there. At ovulation stage, the LH will be very high. So if yours does not follow that trend, it means either you have late ovulation. So it means your LH takes time to build up. So while you should be ovulating, you are not ovulating. Okay? So there will be 3 stages to match the value. Okay? So LH is checked at day 14. Now, estrogen and FSH. You see, estrogen will allow the uterus to grow back. So from 1 to 5, you can check estrogen. So if actually for menses, we don't check any hormone during menses. Okay? During menses, all hormones are down. So we don't check them during menses. Okay? Because shedding off, your immune system goes down, your hormones are all down. So we don't check hormones during menses. So for estrogen, you allow 1 to 5 to go out, and then if you look at the timetable, somewhere around 10 to 11, estrogen is high. Okay, 10 to 11, estrogen is high. So if you want to check FSH, you check FSH and estrogen at the same time, 10 or 11 days. 10 or 11 days. Okay, so estrogen and then FSH, follicular stimulation hormone, are checked at the same day. Remember, FSH is coming from the pituitary gland. That will affect the T-cell cells to produce estrogen. Okay, so the estrogen from the T-cell cells of the follicle, and then LH is from the pituitary gland. Remember that. FSH is from pituitary gland. LH is also from pituitary gland. Okay. Now, when you write ovulation from 15 to 28, ovarian cycle, just write luteal phase. Luteal phase. Luteal phase because that is where we have corpus luteum producing. You see, there's releasing. So there's corpus hemorrhagicum, corpus luteum. If there's no pregnancy, we have corpus albicans. Okay, so it's a luteal phase. Luteal means secretion. Okay, luteal phase. And for uterine cycle, the same is secretory phase. If you look at the uterus at that time, it's very succulent. I had there. Okay, uterus there, very succulent, so that implantation will be accepted. So there's aspirin there, there's sugar there, there's everything there. And this is to make sure that there is implantation. So for the same phase, the uterine phase is secretory. So there's a lot of gland secretion there. Okay? And then for the ovary is the luteal phase. So if I want to check progesterone, I will check progesterone on day 21. Progesterone surge at day 21. Okay? So if you have sex during ovulation and anything, by day 21 there's implantation. So automatically estrogen will go high. So estrogen, naturally, if you are not even pregnant, estrogen surge at day 21. So if you want to check somebody's estrogen, we have a program that we call preconception care. Preconception care are for ladies who want to get pregnant. There's a rule for preconception care. We have the do's, the don'ts, and everything. Okay, so for ladies who want to get pregnant, our preconception care, day 21, we check progesterone. You are not pregnant, but if progesterone does not surge very high at that time, it means there's a trouble. Okay, so those who get miscarriages, your problem has to do with progesterone. That's all. Apart from the cervix aspect that at times opens, the number one cause of miscarriages is low level of progesterone. So if you're a lady who wants to give birth, these are the hormones you should check, and you should know when to check them. Okay, so 21 days progesterone. When you check, it's actually at the luteal phase. So you should look at the range at the luteal phase. You should match exactly what you are doing. And then for me, personally, if I want to do anything, that's the time that I'll ask the person to do an ultrasound. And I'll be looking at the thickness of the endometrium, because at that time, the endometrium should be at the full thickness, the full height. Okay, so whilst you allow the person to do the 21 days progesterone, you also allow her to take an ultrasound. And then your aim should be to know the ovarian volume, to also know the thickness of the endometrium, and then you add the others. Okay, so by that time, the endometrium should reach somewhere around 10 millimeters, 11 millimeters. Okay, but if you check and the endometrium is around 5 at that time, it means the endometrium too does not grow much. Okay, so these are the do's and don'ts. Okay, the do's and don'ts. Okay, so can we quickly go over the hormones? I said that one, you can write it down. Estrogen and FSH are checked at the same time, day 10 or day 11. LH is checked during ovulation, day 14. Progesterone is checked at the peak, that is day 21. Are we okay?
Yes, sir.
Are we okay?
No, sir.
No, sir, please.
I'm repeating it. Number one, estrogen and FSH, they are checked the same day, day 10 and day 11. LH is checked at day 14 because of ovulation, and progesterone is checked at day 21. Are we okay? Are we okay?
Yes, sir.
Good.
Yes, sir.
So what about other hormones? Other hormones like Prolactin, other hormones like the male hormone, other hormones like AMH. I hope you know when we check AMH. Okay? Hey, wifey, yes, Katerina. Catherine, your hand is up. Okay, clarify yourself. Yes. Day 14 ovulation. Hey, please don't. The luteal phase, yeah. Yes, there are 3 there. That's the phases. And then for uterus, uterine cycle has day 1 to 5 as menses, a 6 to 13 or to 14 as proliferative stage. And that's why I was warning you that don't interchange follicular and proliferative. They are not the same. Follicular is equal to menses plus proliferative stage. You can do it mathematically. I like math, so everything I put it mathematically. Follicular phase at the ovarian is equal to menses plus proliferative stage at the uterus. Okay? And then luteal at the ovarian is also equal to secretory at the ovary. And that's all. So you should know which stage. Because some people write the report and they will interchange it, thinking it's interchangeable. You can't interchange them. Know exactly what you are looking for. Okay? Okay, so let's go to the other hormones. Hormones like prolactin. I said we don't check any hormone during menses. We don't do that. All hormones are low during menses. So if I have to check the person's prolactin, you see some ladies are not pregnant, but they have high level of prolactin. High level. What happens? If somebody has high level of prolactin, what's the problem? And what's the number one risk that any clinician will look for? Yes? High level of prolactin. What's the problem? And what's the risk? Let me look at some of your infertility. Somebody said infertility. That's patient. Patient has infertility. That is not a risk. When you say something is a risk, it means it can kill you. Yeah, the 3 stage. Who is that? Upon Chumwa. The 3 stage of ovarian are follicular phase, ovulation, and then luteal phase. Okay. So I say high level. Somebody are saying hormonal imbalance. That one doesn't even come. When I say it's a risk, risk means to kill you. Who is that person? PCOS will not kill you. When people have high level of prolactin, now this is the problem. Listen carefully. It's not about even fertility. Prolactin is produced by the pituitary gland. So when you are not pregnant and the pituitary gland is starting producing high level of prolactin, it means you are getting pituitary tumor. And pituitary tumor will give you severe headaches, blindness, and eventually can kill you. So when people come to our end with high level of prolactin, we are not concerned about the fertility issue because number one, you can't give birth. When prolactin goes high, estrogen goes low. So your body is already in family planning. Okay? But our concern is not even there. The concern is that when you have high level of prolactin, problem is that your pituitary gland is becoming big. So we take a CT scan. If it's not that enlarged, we have drugs that can constrict it, and then the prolactin level will cease, and then we can give birth. So having a high level of prolactin is a risk. You can die. You see? So high level of prolactin in you means that you have pituitary tumor. Okay, so if you're a lady, you are not pregnant, and in your you always examine your breast and you see milk coming out, don't be happy. Don't be happy. Okay? At times it allows your breast to become big. Now they are shattering. That's not the issue. The issue is that you are getting pituitary tumor. So those people always have constant headaches. Constant headaches. Okay? And then the chiasma of the optic nerve is anterior to the pituitary gland. So when the pituitary gland becomes big, it will press on the chiasma. It will affect your vision. Your eyes will be there, but you can't see anything. You have blurred vision. Later you become totally blind while your eyes are there. And then later, it's going to kill you. So those of you who have high level of prolactin in you, please, the risk is that you can die. Grace?
Yes.
Yes?
Sir,
Yes, go on.
I want to ask the question.
Yes, go on, my dear.
I know of someone who had a high level of prolactin, and the person went for an eye test, and like they took scan and everything. But then they were saying that there was something wrong, but the scan was also saying otherwise.
So now you know what is wrong with the person. Help the person out, okay? It's not the problem is not even from the eye. The problem is from the optic nerve that has been compressed. Okay? That is why you are doing degree. So you see what school has done to you. Now you can help the person. That's why you are here, to be able to help people. So go and help her. Now you know what is wrong with her. The medications to solve it are just 2 or 3 medications, depending on the category of tumor that she has. Okay? I won't mention any drug here, but the drugs are available, readily available. So ladies on the platform that have high level of prolactin in you, that is the issue. So the risk is that you can die, and then going blind before dying. Okay? Yes, Stella.
So please, my question is, a client of mine came in for info injection. That's the family plan, 3-month injection.
Yes.
She took it for 1 year.
1 year.
After the 1 year, yes, for 1 year. So after the 1 year, as I speak now, the message is not coming.
Okay, so Stella, if I tell you what to do so that she gets her menses back, what would you do? How would you charge her? So that I'll tell you quickly.
I'll charge her to
Ah, Stella. Ah, Obi, 4 years when you're the menses, 2,000 pen now by year. Now I'm saying. Ah, 1,005 days. Kite me there. Okay, now listen carefully. Stella, who are here? Who are here? Oh, and you know, don't worry. From your children, show there, main come will be on TV. No man for yet. A man for ya, me patch out embryology and bachelor, my mature from ecology. Me patch out, more from ecology, Musam from ecology lecture. Okay, listen. Stella, what you have to do, you see. Oh, me patch up. Mom, come ask him. Why? Don't worry. The questions can be asked at the Telegram page. So Stella has a special thing. That's why I'm saying she should ask me, and I'll reply her. Okay. Now the issue for Stella is simple. I've told you for Prolactin. You see, keeping pregnancy. So what happened to the lady is that the depot has increased her progesterone level, such that the estrogen level is low. So the endometrium is not growing at all. That's what is happening to her. So to reverse it, what do we use to decrease the level of progesterone? It's just one drug. Okay, when she takes that drug, estrogen gradually will go off, progesterone will eventually go off, and then estrogen will come up, and then of course her menses will start. So that's what Stella should do. So what drug and how to give it is what I said I will give it to her. Simple. So that's the issue of progesterone and estrogen. Not only depot, those of you who are doing family planning, what's wrong with you to work on family planning? Wouldn't the airbag or shed that yeche cry anti-minjo? Okay? Till the make any ye, they wouldn't be obey to me. Okay? So now you know your cycle, you know your conception period. If you are desynchronized, yours is different. Desynchronized, I've explained what is desynchronized, okay? And I also explain the synchronized. Most people are synchronized. Desynchronized in India are different. Menses equal. Na ovarian ovulation see wonya uterus ne yakese na sabre na kusuan so nti on dey na say different. Okay. So for the lady, that's the only thing. You should bring down the progesterone using estrogen. Okay. And then there's a small drug that people don't respect that drug. Oh, a small drug be a very reversing. This tell her I don't look around or talk around mocha 1,000 kora, 500 kora. Oh, mocha 500. But I can say, no, tell me, what's your answer? Why? Oh, and your folic acid. Folic acid will not do that. Folic acid, and a docket to be a 2 pet. Open so blue now, back or a share UK, a share you. What's that command prominent end? Just out the one for damn one root. Obi at the key progesterone, prominent end, so your progesterone. What I just said, a wood yarn, a wood team. Huh? Root crowd me, we can buy boom, cow ye ni papa. Eh? So please, you contact me, contact me, and then I'll show you the trend. I'll put it on the page so that you all see. Okay? I'll put it on the page so that you all see. Okay? So that we all see. That's all. Okay? Okay, fine.
Okay, thank you, sir.
Now, what case in EBNT? You see, let me ask you one question, midwife. Has somebody come for family planning and you've taken your time to check the hormones before putting them on family planning? Have you done that before?
No, we don't do it.
Some people naturally have high level of progesterone in their body. High level. What's that called in depot? Hey, when you're permanent family planning. Permanent. So ladies, now you know the truth. You see, don't just put people on family planning just like that. Check the hormones. Some of them have none, so automatically when you put it on, then there's others have average, others have normal. But those who have high of that hormone and you still put them on that family planning, you've killed them. I know that lady has stopped. Maybe she wants to give birth now, and now there's a trouble. So please do that, okay? You check their full blood count, because if you're anemic, that's another ball game altogether. Check their full blood count. You do that, you do this before you give them, you prescribe their family planning. Don't be naive. You are doing degree now. This is degree, not diploma. Diploma is 17 now. That Bible say, "Na me shano, na me DA. Now you are feeding me with milk. Now I'm an adult. I take solid food. Now you're adult now. Some milk time ni na manim chem. Okay? Do the right thing and save life. You are not supposed to make life complicated. Still, like come over life are complicated. I feel like don't worry. I'll put it on the page to help you. Now let's look at the hormones carefully. Now that is prolactin, okay? Hey, Asantua Joyce. I also have Asantua. You better count the end later. You better count the end. So I want to check your ovulation. I am here, that rapid test that you use for ovulation. Opa ovulate we cross and I saw ovulate. Hey, I mean come as now. The other hormones are testosterone. Testosterone, you see, is produced in males. We know that it's a Leydig cell that produce that one. Okay, but how would females have high level of that hormone? They don't have testes, so how would they have high level of that hormone? Yes, quickly answer me. How would females have high level of that hormone? They don't have testes. Males, we have testes, so we produce high level of that hormone. It gives us muscle, it builds our body, it gives us facial hair, breaking of voice, and everything. Okay. Ladies do have that hormone, but in smaller quantity. But some ladies can overgo. Theirs is higher than the male. Okay. We are better now. You're on the testosterone level was strong. Okay. So these are some tests I ask the gentleman to do before say and do. Check up on the testosterone level. It was so chair well, but show palm when we say wait me. Okay. So these are the things. So how would a lady produce that hormone in higher quantity? Yes. There's no testes. So how would they produce that hormone in higher quantity? Oh, some of them, they don't have PCOS. So some of them don't have PCOS. Some of them don't even have PCOS. Obu only PCOS. Okay. So it's not because of the PCOS. There is something in them that produce that hormone. Okay. Males is testes. Females is what? What structure in females to produce that hormone? Quickly. The cortex of the kidney. Who is that? Cassandra. Oh, I want to accept that answer. So we are cancer, man. The content, yes, Beatrice. Beatrice said adrenal gland and ovaries. Beatrice, you see, where Google the answer now, and AI. It's not the ovaries that come home. Adrenal gland is good. We also call it suprarenal gland. Suprarenal gland. They are on top of the kidney, but they are not lying on the kidney. We call them suprarenal gland or adrenal gland. Okay, they produce the male hormone in females. So at times they are overstimulation, and they can produce higher level more than the testes, and then the female becomes Boatemah. Okay, they have body hairs, facial hair, chest hair. Their body, they are well built. Their voice is broken, and they are strong. So now we've told them, gentlemen, before you say you do, check all these things. And they are very agitative. Okay? Before they say I do. Or what your banner ban wash or banana, I check your banner chair so you and a cheat, your fuso, in cocoso, what 24, the catch or by your show. Okay. Okay, so for the women who menstruate 3 days, somebody's asking that. Women who menstruate 3 days. You see, when you menstruate 3 days, your free period is also narrowed because your cycle is okay. Menstruate 3 days, your free period is also 3 days. So day 4, day 5, day 6, yours is done. Okay. People menstruate 3 days, usually they have a cycle of 25 or 24, 23 there, but so everything about them is short. So 3 days the free period is 3 days too. But remember, for them, the day 3 is also just like day 5 of a 28 person. Okay. We are all humble. Hey, Matilda. Matilda doesn't we you. Class, you will be a bad man or two. Then it's Uko adwuma we fa na King Kong. Ama King Kong. Ti adwuma mu na wo popo nkrofo. Okay. Oh, money King Kong hospital. Hospital we brave na mo King Kong fu. We sure buy am so King Kong. Guru ho bebo. Okay? So the other thing is that if yours is some okay. Obi menses was say 3 days and I cycle year 25. Now, who is that person? Stella, what was your menarche menses? Menarche menses means that your first cycle, your first menses, was it 3 days? Stella.
Yes, sir. It has been 3 days, sir.
So your first one was 3 days.
Yes, please.
So so that is it. So you have 3 days. So your same period are also 3, my dear. So you do your calculation. So when would you have your ovulation? 25 divided by 2. Yes. So it means you usually get ovulation in the afternoon, oh, mommy. It's 12.5. So afternoon. 0.5 is afternoon. Stella, are you there? So you usually get ovulate. You usually ovulate in the afternoon. Are you married?
No, please.
Do you have a boyfriend?
Yes, sir.
Okay. So you know what to do. You are the afternoon ovulating woman. Afternoon to afternoon. So usually 12.5 in exams you convert it to 13. Okay. When you divide and you get 12.5, you convert it to 13. Okay. But if there's 12.5, choose that answer. But if there is none, you choose 13. Okay. I don't know, but sometimes I feel like beating my husband. Yeah, can come and do her. Can come. Why no? Come Boatemah. Or back can come. Oh wait. Oh, she's gone. Let me look for King Kong here. Hey, at the sherry man, yeah. The me hey, baffle. You feel like beating him, Menstrual, and what is that? Don't feel like beating him, oh, please. Yes, I will come and for Menstrual. Let's look at it and work on it for you. Go and check your male hormone. And do you get angry easily? If you get angry easily, also please check that hormone. And to suppress that hormone is just 2 drugs too. It will be suppressed forever. Okay? So please, let's look at the hormones. Let's do a quick recap.